Good evening, Chair Van Dever and members of the committee. My name is Grace Atkins. I appreciate the opportunity to testify today on the Texas healthcare workforce shortage. I know it has been a long day, so I will try to keep this as short and simple as possible. As we have heard, Texas continues to face a significant healthcare workforce shortage, particularly in high-demand fields such as nursing and allied health. Addressing those shortages will require sustained alignment between higher education, workforce demand, and state funding policy. In 2023, under Chair Van Dever's leadership, Texas led the nation by transitioning community college funding to a 95% outcomes-based model. By tying funding to student outcomes, including credentials of value in high-demand fields, the state created stronger incentives for institutions to expand programs connected to workforce needs. And the early results are encouraging. Health professional credentials awarded by Texas community colleges largely remain stagnant for the 10 years leading up to the passage of House Bill 8. Since implementation, those credentials have increased 18.3% in just 2 years. That growth did not happen by accident. It reflects institutions responding to clear state priorities and investing in programs that meet workforce demand. But maintaining that momentum requires sustained state commitment. Healthcare programs require long-term investments in faculty, equipment, clinical placements, and partnerships with employers, and colleges can only make those investments when funding remains stable and the incentives remain clear. Healthcare workforce needs vary across the state. Some regions face severe nursing shortages while others struggle with behavioral health or allied health occupations. Outcomes-based funding gives community colleges the resources and incentives to invest in the programs their communities need most. As the committee continues evaluating healthcare workforce shortages, Texas 2036 encourages the state to remain committed to outcomes-based funding for community colleges and to continue funding and refining the model so institutions can keep building the healthcare workforce pipeline Texas needs. Thank you, and I'm happy to answer any questions.